Most people think that retirement starts at 65, but if you've saved consistently and invested well, you may have the option to retire much earlier than that. And one of the biggest decisions in that transition is health insurance, because the moment you leave your employer, you're stepping into a gap that can last 5 years or more before Medicare begins. And how you handle that gap doesn't just affect your coverage, it affects your taxes, your income strategy, and ultimately how efficiently you use your portfolio early in retirement. So in this video, I want to walk you through the real options that you have if you're choosing to retire early, what they actually cost, how they work, and more importantly, how to think about them within a coordinated retirement plan. But first, I'm Justin Haywood. I'm a certified financial planner, and I've helped hundreds of people retire with confidence, and I want to help you do the same. Let's start with the reality. Health insurance before Medicare isn't cheap. In many cases, it becomes one of the largest expenses early in retirement. Here's where most people get this wrong. They treat it like a fixed cost, something you just have to pay. But in reality, it's one of the few areas where good planning can significantly reduce what you spend, because your premiums aren't just based on your age or your health. They're heavily influenced by your income. And in early retirement, your income is something that you can control if you plan it correctly. So let's walk through your options. The first, and for most people the most important, is the Affordable Care Act marketplace. This is where you can go out and buy private health insurance once you leave your employer. These are full, comprehensive plans. They cover doctor visits, hospital stays, prescriptions, preventive care, and they cannot deny you for pre-existing conditions. But the real opportunity here isn't just the access to coverage, it's how the pricing works, because these plans come with income-based subsidies. And what that means is that two people with the exact same net worth could pay completely different amounts for the exact same health insurance, based entirely on how they structure their income. Now, how you control that income, that's where planning becomes incredibly important. And I'll come back to that in just a minute. But the second option is COBRA. This allows you to keep your existing employer plan for up to 18 months after you leave. The advantage is pretty simple. You keep everything exactly the same. Same doctors, same network, there's no disruption. But the trade-off is cost. When you're working, your employer is covering a significant portion of that premium. But once you go on COBRA, you're paying the full amount plus a small administrative fee. For many people, that means a significant jump in monthly cost. So COBRA usually isn't a long-term solution, but it can be useful in specific situations, like if you're in the middle of treatment, if you've already met your deductible for the year, or if you just want a short-term bridge while you transition to a marketplace plan. It can make sense strategically. The third option is your spouse's employer plan. If your spouse is still working and has access to employer-sponsored insurance, this is often one of the most cost-effective paths. Employers typically subsidize a portion of the premium, even for the dependents, and the coverage is usually strong. The main limitation here is timing. You may need to coordinate your retirement with their enrollment period or qualify for a special enrollment window. But if this option is available, it's often worth serious consideration. Option number 4 is retiree health benefits. This is different from COBRA, which simply lets you stay on your employer's plan temporarily and pay the full cost. Retiree health benefits are actually employer-provided coverage that continues after you retire, sometimes with a subsidy. Some people do have access to this, especially if they've worked in government roles, unions, or they've had long tenured positions at larger companies. And if that's available to you, it can be really valuable. But you want to be very clear on the details. Before making any retirement decision, you want to confirm a few things. Do you actually qualify? How much of your premium is covered by your employer? And most importantly, does it fully bridge you to Medicare, or does it leave a gap? Because if there's still a gap, even for a year or two, that needs to be planned for. And depending on what you find, this can either simplify your strategy or put you right back into needing to coordinate income, taxes, and healthcare through the ACA. The fifth option is Medicaid. For most people in your position, this isn't going to be your primary strategy, but it's still worth understanding how it fits into the bigger picture. Because in early retirement, there may be years where your income is intentionally very low. Maybe you're delaying Social Security or drawing from after-tax accounts. Maybe you're managing your income to create space for Roth conversions in other years. And in those lower income years, it's possible, depending on your state, that you could qualify for very low cost or even no cost coverage. That's not something that you should build into your plan entirely, but it's an example of how flexible early retirement can be when you're coordinating your income, taxes, and healthcare decisions together. Beyond these options themselves, there are a few planning principles that really matter. First, this is not something that you figure out last minute. If you're seriously considering early retirement, this needs to be part of the conversation well in advance, because the decisions that you make in the years leading up to retirement will directly impact what your options look like once you get there. For example, how you structure your assets, tax deferred, Roth, after tax, that's all going to affect how much control you have over your income once you stop working. And that income is going to drive things like ACA premiums, subsidy eligibility, and overall healthcare costs. And the same goes for timing. If you retire mid-year versus at the beginning of a year, if you take a large distribution in 1 year versus spreading it out over several, if you start Social Security early versus delaying it, all of those decisions show up in your income, and that flows directly into what you pay for your health insurance. It's not just about picking a plan once you retire. It's about setting yourself up in advance so that when you do retire, you actually have flexibility. Because the more flexibility you have, the more control you have over both your costs and your overall retirement strategy. The second thing to be aware of, and this is where everything starts coming together, is that your income strategy drives everything. Remember earlier when we were talking about the ACA premiums and how they're based on income? This is where this becomes real, because in early retirement, income isn't just something that happens to you. It's something that you actively control. And that one variable flows into almost every other decision that you're making. It determines what tax bracket you're in. It determines whether or not you qualify for ACA subsidies. And it determines how much you're paying for health insurance. So if you're looking at these decisions in isolation, choosing a health plan over here, doing a Roth conversion over there, taking withdrawals without a clear structure, you can very easily create unintended consequences. You might push your income too high and lose subsidies. You might miss opportunities to convert at lower tax rates, or you might simply end up paying more than necessary all across the board. But when these decisions are coordinated, when your withdrawals, your tax strategy, and your healthcare decisions are working in concert, that's where you start to see a very different outcome. Lower overall costs, more predictability, and a plan that actually works the way that it's supposed to. Third, if you have access to a health savings account while you're still working, use it. HSAs are one of the most effective tools for this phase of retirement, and they're really often underutilized. They offer something that I call a triple tax advantage. Contributions are tax deductible, growth is tax deferred, and withdrawals are tax-free when used for qualified medical expenses. And that becomes especially valuable in the years before Medicare, because those funds can be used tax-free to cover premiums and out-of-pocket medical costs during that gap, which means that instead of pulling money out of your traditional IRA or out of your other parts of your portfolio and potentially increasing your taxes or reducing your ACA subsidies, you can draw from a source that doesn't show up as taxable income at all. And that gives you even more flexibility in how you structure everything else. Finally, let's talk briefly about cost expectations. If you're buying a marketplace plan without subsidies, you could be looking at several hundred to over $1,000 per month, depending on coverage and household size. With proper income planning and subsidies, that number can come down significantly. COBRA tends to be on the higher end. Employer-sponsored coverage through a spouse is often more moderate, but the key point here isn't the exact number. It's that this is a real material expense that needs to be built into your retirement plan. And at the end of the day, retiring early isn't just about having enough saved. It's about making a series of decisions that all work together. Your investments, your income, your taxes, and your healthcare. If those decisions aren't coordinated, you can end up creating unnecessary costs and a lot of inefficiency. But if they are, you create a retirement that's not just possible, but controlled, predictable, and aligned with how you actually want to live. If you're thinking about retiring early and you want to understand how all these pieces fit together in your specific situation, that's exactly the kind of planning that we focus on at Haywood Wealth Management. But either way, don't ignore this part of the decision, because how you handle health insurance in those early years can have a much bigger impact than you realize. If you found this video helpful, please let me know in the comments. I'd also like to know, what's your biggest question around retiring before Medicare? If you're looking for someone to help you navigate these important decisions as you prepare for retirement, I've included a link in the description where you can schedule a call directly with me. And if you're looking for another video to watch to keep learning, I've recorded one right here.